First of all, I'm very happy to be with you here with LargeV. From my experience and what I saw today in the exhibition, I saw the LargeV machine and I saw the other machines here in the exhibition. A lot of differences we have. The ease of use of the software, in addition of having multiple programs for FOV, which makes us easy to make different tasks. For example, we have the 50 micron voxel size, which is perfect for the endodontic mood. And also in the same time, we have the big size, voxel size, which is 250 microns, which is make it easy for reconstruction for the images, not to make the computer heavy for any dentist to work. A lot of varieties is offered, and it's really very nice and very encouraging. In my opinion, we have the strong body, but we need to upgrade more the software. So I believe that any product have a big body with the hardware and the mind, which is the software. For any product, we have two main factors. The factor which is the body and the muscles, which is the hardware, and the other factor is the mind, which is the software. Regarding the hardware is fine for me, it's very satisfying, but for the software, as technology goes and development goes, we need to upgrade the software to have more AI features, to have more specific features or more scientific or specific tools, especially for root canal treatment and implants. So, and this is easy. I think it's easy to achieve by time, but overall I'm really satisfied with the product.
So do you think after-sales service it's important for pick up equipment from dentists or doctors?
Of course, the after-sales service is the backbone of any product. So if you have the best product but you don't have proper after-sales service, you will not be relying on a solid ground. So I think the after-sales service is very important for the success of the machine and the dentist and all of us in the same ship. I have a very good idea about LargeV in Egypt. The distributor in Egypt is very professional, very caring, solved any technical issues quickly, very supporting in giving the knowledge about the updates of the software and the hardware, making events, making scientific education. Yes, of course, and this is a very good example that I have here in the MENA region. And I wish that all the distributors in the region and all over the world will have the same manner of performance. In my opinion, AI has a lot of stages. So the first stage is the technical stage or clarity stage, something like nerve tracing for the if you have a canal, something like drawing the arch curve to get the reformatted panoramic, which is already available in some brands. When we go to higher levels, the segmentation, the AI segmentation, by differentiating the jaw bones and the teeth parts, as well as the pulp spaces. When we go to a higher level, which nobody have reached till now, the eye diagnosis to diagnose common dental problems like caries, like periapical lesions, like periodontal problems, in addition to the last stage, which is the best, of having guided surgery AI-based guides. So the trip is long, and I hope that we reach all of this in a short time. As I mentioned in the beginning, any product has its muscles, which is the image quality and the hardware and the software. In my opinion, I'm surprised with this technology coming from China, very high quality images, very good performance in lowering the streak artifacts from metal, and also very good quality for the endo program, which is very important because, in my opinion, I believe that two main factors: differentiate between each machine and the other. The first one is the ability to dissipate metal artifacts, and then the high performance and the high quality diagnostic images coming from scanning small areas like endo programs. So I'm very well satisfied, and I wish to upgrade and upgrade all the time. As we receive the patient, we must make a clinical examination. Based on the clinical examination, we will see the suspected dental conditions in the patient's mouth. So based on this evaluation and the professional judgment, we choose the suitable FOV. For example, if we have an endodontic case which is complicated due to previous failed treatment or endo-perio complex, so we should choose the smallest FOV available for endo mode in order to get the best resolution to catch up the minute structures like missed canals, like unfilled canals, like incompletely filled canals, cracks, a lot of issues. So this is the use of the small FOV. For the implant cases, we should use the FOV that covers the area of interest, the missing teeth. In cases of planning for surgical guide, we should scan the whole jaw in order to get points on the cusp tips and incisor edges for registrations with the STLs or the PLYs of the intraoral scanners. For maxillofacial areas, which is mainly in hospitals, like accidents or something like this, we need the biggest FOV possible from the nasien to the soft tissue menton vertically, and from the condyle to the other condyle horizontally, in order to cover the whole maxillofacial areas. This is my view about the FOVs. We select FOV, of course, after clinical examination. We make the evaluation which areas which has potential or possible dental problems. For example, we select the small FOV in case we have a root canal case. Complicated root canal cases like previous failures or endo-perio problems or missed canal problems. In these cases, we use the smallest FOV with the highest spatial resolution. So we use the smallest FOV with the voxel size 50 microns. Then, in cases of having implant cases, we check the areas which are going to be restored. We choose the smallest possible FOV to cover the area of interest in order not to give the patient unnecessary dose of exposure. But in implant cases which we are planning for future surgical guide fabrication, we should scan the whole jaw in order to get more teeth structures from cusp tips and incisor edges, to use them in registration over intraoral scans and cast scans for making the surgical guide. If we have a case that we are in a hospital and having future oral maxillofacial surgery, we need to have the full field of view from the nasien upward till the soft tissue menton downwards, and horizontally from the condyle to the other condyle. LargeV, you deserve it. LargeV, you deserve it.